talking about cardinal movements in the mechanism of labor. So, mechanism of labor means a series of movements which is occurring in the fetal head during the process of adaptation during its journey through the pelvis. So the pelvis, if we talk about the inlet, it has the maximum transverse diameter. The transverse diameter is the maximum at inlet. So most of the position are in occipitolateral position, whereas in output the interior posterior diameter is the maximum. So the head has to rotate from its lateral position to interior posterior diameter before it gets delivered. So these movements which are occurring in a fetal head in the process of adaptation is known as mechanism of labor. So the first movement in mechanism is the engagement. What is engagement? When the maximum transverse diameter of the fetal skull. Now what is the maximum transverse diameter? It is the biparietal diameter, that is the diameter between the two parietal eminences. When this diameter it has crossed the plane of the pelvic inlet, the head is said to be engaged. This is very important. In primary, engagement occurs during the last weeks of pregnancy, whereas in multis it occurs when the labor starts. So engagement is the first step. Then descent. Descent is a continuous movement which occurs throughout the first and the second stage of labor. So descent is a continuous movement which is occurring. Third is flexion, that is flexion of the fetal head. There is some degree of flexion which is present at the beginning of the labor only, but as the duration of labor increases, this flexion of the fetal head goes on increases, so that the minimal anterior posterior diameter, that is the suboccipitopragmatic, it is the leading diameter which is 9.5, and this is the minimal diameter. Thereafter after flexion there is internal rotation. When the leading part of the well flexed head, so what will be the leading part of the well flexed head? It will be occiput. So if the head is well flexed, occiput would be the leading part. So when it touches the levator ani, the elastic recoil of the levator ani leads to internal rotation of the occiput, bringing the occiput under the symphysis pubis. This is internal rotation. Thereafter there is crowning. When the maximum transverse diameter, it stretches the perineum and there is no recession even when the contraction passes on. This is crowning, and it is at this step you have to give episiotomy. Thereafter the head is born by extension, where the vertex, brow, face and the chin is born. After this, because of the internal rotation of the fetal head, because the occiput came under symphysis pubis, there was a torsion in the fetal neck by 1/8 of a circle if we talk about left occipito-anterior diameter. So to bring the neck to rest, there is a movement of restitution now. So it is in the direction opposite to that of internal rotation. So for example, this is the occiput and the occiput rotated like this. So there is a torsion in the neck. The head is delivered by extension. Now it will come to rest. So it will come like this again. This is restitution. This occurs so as to detort the neck, which was there during internal rotation. Now the shoulders have to deliver. So for anything to be delivered, it should come in anterior posterior diameter. So now the shoulders come in anterior posterior diameter, which results in external rotation of the fetal head again by 1/8 of a circle in the direction same as that of external rotation. So if internal rotation is occurring like this, restitution will occur like this, and external rotation will again occur in the same direction. Thereafter the rest of the body is born by lateral flexion. So if we talk about the delivery of the shoulders, it is the anterior shoulder which hinges behind the symphysis pubis and is delivered first, followed by posterior shoulder, and then the rest of the body is borne by lateral flexion. Thank you.